Welcome to the second case presentation this afternoon. We would like to invite Vilas Padurangi to present his paper on left bundle branch pacing for cardiac resynchronization therapy. Dr. Vilas Padurangi, please.
Good morning to one and all present here. I am Jaya Pradhap from Madras Medical Mission Hospital, Chennai. It's my privilege to present is bundle pacing for CRT in IHRS 2019. At the outset, I would like to thank Dr. Vilas Padurangi for giving me this wonderful opportunity. In our institute, we usually do is bundle pacing for CRT as a primary approach. We revert to conventional biventricular pacing in case of failure to achieve narrow QRS and good pacing threshold in is bundle pacing. Is bundle pacing recently has been considered to correct AV blocks and achieving narrow QRS. Recent reports have also shown improved outcome with direct bundle branch pacing at the distal is bundle or proximal bundle branches in the intraventricular septum. I am privileged to showcase few cases of resistant heart failure with left bundle branch block and right bundle branch block and non-specific wide QRS. This was 45-year-old female with severe LV dysfunction, intermittent high-grade AV block, resistant heart failure. Her baseline ECG shows prolonged PR interval with right bundle branch block. We took her for this bundle pacing with our EP system. This 1, 2, 3, 4 are bipolar electrogram obtained from pre-shaped quadripolar is bundle catheter placed at the is region. This lead one is the bipolar electrogram obtained from the Medtronic Select Secure 3830 is lead, and this unfilled is the unipolar electrogram. We paced at the proximal is, which resulted in a wide QRS. So we went mapping the distal is, pacing at the distal is resulted in narrow QRS, so we screwed there, and this was the final lead position, and this was the final ECG which resulted in very narrow QRS. And this was 59-year-old male, dilated cardiomyopathy, severe LV dysfunction, NIGA class 3 to 4 dyspnea. This baseline ECG shows left bundle branch block with a QRS duration of about 160 millisecond, the leftward axis. Pacing at the is bundle region resulted in wide QRS, which implies pacing at the site proximal to the block. In this case, it also implies that pacing at proximal to the block, even at high output, did not correct bundle branch block. Hence, we decided to go further distally across the tricuspid valve into the interventricular septum. As you could see here, in LFO view, the lead is perpendicular to the interventricular septum. The left bundle potential in left bundle branch block is within the electrogram and not seen clear. In occasional cases, we confirm left bundle potential by using two maneuvers, which is by pacing left ventricle or looking for PVC of RBBB morphology. As you could see here in narrow QRS, the left bundle potential is recorded before the local electrogram. In left bundle branch block, the left bundle potential is within the electrogram. However, pacing at the left ventricle and PVC of RBBB morphology may bring out left bundle potential. There, pacing lead can be screwed. And as you could see here, the lead is into the interventricular septum. During screwing, impedance and thresholds were noted in unipolar pacing. At higher output, it results in capture of both left bundle branch as well as local myocardium. In lower output, it results in selective capture of left bundle branch. This was the final lead position. This is the final ECG. At this stage, I would like to show an case which corrects left bundle branch block by pacing at the is bundle region, what we usually do in our institute, rather than going across the tricuspid valve into the interventricular septum for pacing left bundle branch. This was 63-year-old male, ischemic cardiomyopathy, severe LV dysfunction. His baseline ECG shows left bundle branch block with QRS duration of 160 millisecond and normal axis. So pacing at the distal results in narrow QRS. So this was final lead position. And this is the final ECG, which is very narrower. Thus I would like to conclude here. Thank you for the opportunity.
Excuse me, what was the threshold like and what are the impedance from these sides?
Yeah, the threshold is around 1.5. Yeah.
And impedance?
Impedance is around